Whether you're preparing for IVF or working on optimizing your fertility, you're in the right place. With so much information out there, I know it can feel daunting. How do you make sense of it all? I hear this a lot from my new patients. From diet and exercise to supplements and herbal formulas, there are just so many ways to help support your body and set yourself up for the best possible outcome with IVF. In this video, part 2 of my series on how to prepare for IVF, we are diving into supplements. I'll discuss the powerful role they play in creating an ideal environment for your fertility and supporting your reproductive health as you prepare for IVF. I'm Dr. Klara Brown, a women's health and fertility expert and doctor of acupuncture and Chinese medicine. I've been helping women make babies for over 15 years. If you're having difficulty getting pregnant and you're looking for a compassionate departure from the often cold clinical world of infertility, I'm here to support you. You deserve holistic care, and providing that is my life's work. Now, the topic of supplements can be a bit controversial. You've likely heard different feedback about whether or not they can support your fertility or improve chances with IVF. You may even have fallen down the internet abyss of options. What could or should you take, when to take them, and so on. But here's the thing to keep in mind. From both a biological and a holistic perspective, the goal with targeted supplements is to arm your body with the key nutrients to amplify its proper functioning. So certain supplements help fill in nutrient gaps where even a healthy diet can struggle to maintain, while others enhance mitochondrial and cellular function, reducing the harm that everyday toxins can have on your body and on your reproductive tract. Whether you have a long list of supplements that you're trying to make sense of, or if you just need some guidance on where to start, I'm going to share with you the top 5 I recommend to my patients focus on when preparing for IVF. The first and most vital supplement I recommend to all my patients is folic acid, ideally as a part of a well-rounded prenatal multivitamin. Now, folic acid helps your body create and grow healthy cells, which is especially important during IVF because it supports the development of healthy eggs and prepares your body for implantation. It also supports the early formation of the baby's DNA. It lowers the risk of birth defects and helps your reproductive system function optimally for a successful pregnancy. Now, in most cases, I recommend methyl forms of folate, such as L-methylfolate, because it offers a better absorption into your body. Now, this is something we absolutely want because women may or may not have a genetic mutation known as MTHFR mutation that might impact how folate is metabolized. And this is not something that's often tested for. I typically recommend my patients at least 800 to 1,000 micrograms of folic acid per day to ensure optimal support. One supplement you may not have expected to hear is vitamin D. This nutrient is essential for hormone balance, immune function, and overall reproductive health. Deficiencies in vitamin D are extremely common, but again, not always checked for, and they have been linked to fertility issues such as an increased risk for fibroids, thyroid dysfunction, hormonal disruption, as well as impacting mood. Studies have shown that maintaining healthy levels of vitamin D can improve pregnancy outcomes during IVF by supporting egg quality and implantation. Now, dosage can vary, so it's important to have your levels checked, but I typically recommend my patients start with at least 2,000 IU per day for reproductive health and their overall well-being. Third on the list is omega-3 fatty acids. Omegas play a critical role in reducing inflammation, improving your circulation, and supporting overall reproductive health. These healthy fats are essential for maintaining hormone balance, for promoting a healthy uterine lining, and improving egg quality, all of which are vital during IVF preparation. When selecting an omega or fish oil, remember, quality is key. You want to choose a high-quality, reputable source, as some of the cheaper brands can actually contain harmful contaminants. And even the ones on Amazon may or may not have been expired or poorly stored that could potentially do more harm than good. A couple of my go-to brands are Nordic Naturals, Metagenics, and New Chapter. So for fish oil, I typically suggest my patients get between 1,000 milligrams to 3,000 milligrams per day, depending on their unique needs. Just as a side note, if you're new to fertility supplements or struggling to find the best options, I've made this easy and put a link in the description to my full script supplement dispensary. Once you're signed up, you'll have access to several of my supplement protocols or bundles that I recommend to all my fertility patients. You'll see foundations for fertility, and of course these 5 for IVF preparation. You'll see specific regimens for egg quality, fertility and endometriosis, as well as male fertility support. So feel free to take a peek at that. Okay, back to our list. Next is coenzyme 10 or CoQ10. You've likely heard of this one a lot, and that's great because this one is one of my favorites. CoQ10 is a powerful antioxidant that helps your cells produce energy, especially in the mitochondria, which is the energy center of your cells. This is important for keeping eggs and sperm healthy. So yes, men can and should be taking CoQ10 as well when you're trying to conceive. Research shows that CoQ10 can improve egg quality, increase the number of mature eggs, and support embryo development by giving cells more energy and protecting them from damage. It can also improve sperm motility and morphology, leading to better fertilization rates. Now, there are two forms of CoQ10, so keep in mind the ubiquinol form of CoQ10 is considered superior to ubiquinone. Ubiquinol is the active, more bioavailable form of the antioxidant, meaning that your body can absorb it and utilize it much more efficiently, particularly as we age. For my patients, I typically advise between 200 to 400 milligrams per day of the ubiquinol form. And number 5, which is not well known but absolutely makes my top 5, and again, something I recommend to all my fertility and IVF patients, is alpha-lipoic acid, or ALA. This is another powerful antioxidant that supports egg quality by reducing oxidative stress in ovarian cells, enhancing mitochondrial function, and promoting a healthier cellular environment for egg development. Studies suggest that ALA also supports hormone balance by improving insulin sensitivity, so this can be especially beneficial for women with conditions like PCOS. Furthermore, ALA has been shown to improve the quality of embryos, making it an essential supplement for women preparing for IVF. I generally recommend that my patients take about 600 milligrams once or twice a day. So those are my top 5 supplements for preparing for IVF. Now, in combination with a well-rounded diet, a healthy lifestyle, these supplements can be hugely supportive to your body as you prepare, ensuring that you have the best chance for success. These 5 are the basics, and they're an incredible foundation for your fertility journey. Is there more? Well, of course, there's always more, and we can get far more personalized through a virtual consultation that would allow me to make further and more specific recommendations based on your unique needs. So I'll drop a link in the description if you want to get in touch about supplements or really any other aspects of your unique fertility needs. I know for many of you, preparing for IVF can feel like an emotional and a physical roller coaster, but I hope this video has provided you with a better understanding as to which supplements you might want to take and why, as well as to guide you a little easier as you move forward. Thank you so much for joining me today. If you found this video helpful, be sure to check out the rest of my 5-part series on preparing for IVF. And don't forget, subscribe for more content designed to support and empower you on your fertility journey. Until next time, take care and trust in your body's incredible ability to heal.